Here's today's Genesis Medical Moments.
October is Breast Cancer Awareness Month, and we are continuing our conversation about breast cancer screening options with Dr. Christine Walsh, the lead radiologist for the Genesis Center for Breast Health. So what can women expect during a mammogram when they come in?
So mammograms are actually a pretty quick test to have done. They really only take a few minutes. So when you come in, obviously you take off your top, and there's a technologist there. These technologists are very skilled. A lot of them have been doing this job for many, many years, and their job is to help make this, as simple and as comfortable of a test for you as possible, because we know it's very anxiety provoking. Yeah. People have heard that mammograms can be uncomfortable. We don't claim that it's a comfortable test to have because it does involve compressing the breast tissue. Yeah. But you have your breast, it goes in an x-ray machine with some compression on it. It takes a picture that just takes a few seconds, and usually there's 4 of those pictures taken in total. So the whole exam really just takes a couple of minutes, and then we interpret those exams usually the same day or occasionally the following day and get those results out to patients right away, because we know people really want to know what those results are.
Right. So what do you tell women who are maybe hesitant about getting a mammogram?
So we know that it's anxiety provoking, and we know that people don't look forward to coming in for these tests. We get all of that, but we also know that it can be life-saving. So the goal of doing screening for anything, including breast cancer, is for us to find disease, to find cancer as small and as early as possible. And we know if we do that, the patient's chance of survival is significantly higher. So it can be life-saving to undergo tests like this. And then we also know that if we find a cancer earlier, that treatment is so much easier and kind of less disruptive to a patient's life. So that's the whole benefit of screening. So we know it's not fun. We know people don't look forward to it, but we also know that the benefits of it are very great.
For sure. How reliable are breast self-exams? If a woman maybe doesn't notice any changes doing these exams, they should still have an annual screening, correct?
So absolutely. So kind of going off what I was just saying, our goal is to find cancer. If we're going to find it, we want to find it very early and very small, on the order of a few millimeters. So those type of lesions, a cancer that's 2 or 3 millimeters in size, is not going to be something you can feel on an exam. So are self-exams good? Absolutely. Like, you should know what your breasts feel like. You should know if there's any changes. And if you find a change, obviously alert your physician. But our job is to find it before a patient can find it. So even if you think your self-exam is normal, you still need to be getting your screening every year.
Right, because you just never know. You just never know. How does someone schedule a mammogram?
So it's a simple test to schedule. You don't even have to have an order from your doctor. You can just call in and schedule it on your own. To schedule with us, you can just call 563-421-X-ray, and they'll help you get scheduled.
It's easy as that.
Easy as that. That's right.
All right.
That's right.
Well, Dr. Walsh, thank you so much for taking the time to talk to us
Absolutely,
today.
I appreciate it.
This was your Genesis Medical Moments. For more information, go to ourquadcities.com and click on the medical tab.